Hey everyone, so now we'll be starting with part 10, and in this, we'll be talking about regional anesthesia. So, regional anesthesia, we have anterior ethmoidal block, and we also have nasociliary block. So, anterior ethmoidal, it is given something near nose like this, and whereas nasociliary, it is given closer to eye. It is given closer to eye. Coming to anesthesia, so these are regional anesthesia, right? So coming to next one, that is caudal anesthesia. It is usually given in children less than 8 years, and here it is given near S3 to S4. So where sacral hiatus is open. So it is given near S3 to S4. Coming to next block, that is supraclavicular block. So in supraclavicular block, we'll be giving this block in order to block this. So if this is person, so we'll be giving it somewhere near clavicle and all. So we'll be doing this in upper limb surgeries, but the risk factors will involve pneumothorax and also phrenic nerve injury. So in phrenic nerve injury, we will see paradoxical breathing, which means during inspiration and expiration, we will have opposite movements, which are not common, like which are actually opposite to what we see in general. So next block is intrascalene. So intrascalene block. So this is interscalene block. So interscalene block, it is given near the scalene triangle. Like if this is sternocleidomastoid, then it is somewhere like this here. So here we'll be giving it. Now it is given for shoulder and upper arm surgeries. However, here one important point is ulnar nerve is spared. So ulnar nerve is spared in this block. Now, so this is like these are vertebrae C4, C5, C6, C7 and so on. So we will be having our brachial plexus. So we'll be having roots first, then we'll be having trunk, we'll be having divisions, then cords, and then we have terminal branches, and here we have umro. So these are also terminal branches. So here we'll be giving interscalene block here, then we can give supraclavicular here, infraclavicular here, and axillary will be given here. So this is how roughly you give blocks. And next we'll be talking about stellate ganglion. Now we'll be talking about stellate ganglion. So stellate ganglion is given near C6, and it is done for Raynaud's and vasospasm and PTSD. So signs will be Horner sign, and then we have Gutman sign. So Gutman sign, we will see nasal mucosa congestion here. In Horner's, we'll be seeing ptosis, as we know. So this is seen first in Horner's. Generally, stellate ganglion, it gives sympathetic supply to head and neck. So this is about stellate ganglion. Now we'll be seeing the next part. Now next we'll be seeing about neuraxial block. So in neuraxial block we have epidural anesthesia and we have spinal anesthesia. So in epidural anesthesia we'll be taking larger dose of drug and then we can give prolonged administration by insertion of catheter. However, it is not quality anesthesia. When compared with spinal anesthesia, it is not that good. But however, this can be adjusted easily and it can be given anywhere. And coming to spinal anesthesia, it is usually given as one shot, single shot injection, and for 3 hours it is given around umbilicus. It is given around the umbilicus and better quality anesthesia and even smaller doses sufficient. So what is the location? It is L3 to L4 is most common, so near the iliac crest, like L4 and L5 line and all. So we'll have Taffier's line. So basically L3 to L4 is the location, and we'll have needles. Like here we have Tohe's needle and we have catheter that can be used. So while entering into the ligamentum flava, we'll be feeling some resistance and later we'll get CSF, so that resistance is gone. So this is one indication that we are doing it in a right way. Now here we will have spinal or lumbar puncture needle. So we have 3 types, which are Whitaker and Sprott. Then we have Quinke. So Whitaker, so it is something like this. It has square pit like this. Then Sprott, so it has a circular pit like this. Then Quirke, it has a beveling end. So this is for dura cutting and these two are for dura splitting. So this is the difference you have to remember. And few points you have to remember will be: in adult, spinal cord is present near lower border of L1, and in children, spinal cord is present near the upper border of L3. And arachnoid, dura, and subarachnoid, all these will be present near the lower border of S2. And now we'll be seeing few more points about this neuraxial block. So contraindications for neuraxial block will include coagulopathies, papilledema, then shock, and increased ICP and local infection. So these are contraindications. Now layers punctured in order will be skin, subcutaneous fat, then we have supraspinous ligament, then we have interspinous ligament, we have ligamentum flavum, then we have dura, and finally arachnoid. So for CSF, we'll be going to till this part, but for like epidural anesthesia, we'll be stopping here itself. So this is one important point you have to remember. So you can remember it like this, SILDA. This is how you can remember it. Now coming to side effects after lumbar puncture. So we have post-dural puncture headache. So this is usually frontal and occipital headache, and it is seen more in pregnancy, and it is decreased on supine position, and also ambulation will increase it. So these are few points regarding this, and treatment will be IV fluids plus bed rest, and if this is not working, then we can do blood patch. So it is usually autologous. The same person will be taking and putting it. So autologous blood patch can be done. Then most common intraoperative complication is hypotension, and most common post-op complication will be urinary retention. So for this, treatment will be phenylephrine. This will be the treatment. So last point is regarding this. Last point will be, so in pregnancy induced hypertension and heart diseases, we will be using general anesthesia or epidural anesthesia, except tetralogy of Fallot and Eisen Mengers. So in these things, we will be using only general anesthesia. So this is about neuraxial block.